Hey mamas! Today I'm going to be sharing with you exercises to avoid if you want to prevent diastasis recti, if you're currently pregnant, or if you have diastasis recti and are wanting to heal. So first off, we want to avoid anything that puts excess pressure on the linea alba. So think front-loading exercises, planks, mountain climbers, even push-ups. That can strain this soft tissue of the linea alba, especially during pregnancy. That softens and expands to make room for baby. So even if you were doing them before, I love a plank myself, I love push-ups. But during pregnancy, I've had to take some time to modify. And you can easily modify these exercises by bringing your knees in closer to your body to take off some of that core pressure, bringing them here in the push-up. But really it's gonna depend on the individual and your ability to manage pressure. So front-loading exercises in general after the first trimester, we can probably avoid doing those for the duration of your pregnancy. Now, of course, if you can properly manage that pressure, go for it. It's going to depend on the person. But in general, if you see any sort of compensation happening, if you see that doming down the midline, bulging out through the midline, or bulging out of the low abs, or just feel out of control, we know that that's probably something we should avoid throughout the pregnancy to prevent severe diastasis recti down the line. Next up, we want to avoid any abdominal flexion exercises. So think crunches and sit-ups. Same thing, it can cause that doming of the midline, that tissue is soft, it's stretchy, it's gonna expand, and that's a natural thing. So diastasis recti is a natural way to make room for baby. But again, to avoid severe diastasis recti, we wanna avoid sitting straight up and straining that tissue. So when you're getting out of bed, for example, you can't always avoid sitting up, but you can roll to your side. But I would say crunches and sit-ups after first trimester, avoid. You don't need to do them to get effective abdominal training. Thirdly, we want to avoid any exercise that causes any twisting motion. Same thing, putting stress on that linea alba, causing excess pressure to go out the midline. So anything like bicycles, any sort of rotational movements where maybe you're using a plate like a Russian twist, anything like that sort of type of exercise. And then we also want to avoid anything that has a long time under tension or something that's really intense. Like if you've ever seen people do a hollow body hold where their legs are up, their arms are overhead, and you're kind of like this, think like a boat pose sort of situation. Again, trying to hold that position for a long time or just putting a lot of strain on the abs. Same thing with anything like leg lowers, Pilates scissors, jackknives, V-ups, anything where you're using a lot of full body movements. Again, flexion, crunching, or just putting a lot of strain, and anything advanced really is probably going to be a no. Again, every body is different, every pregnancy is different, every individual comes in having a different fitness level and a different core and pelvic floor fitness level. So with that in mind, the last thing I would say, avoid any exercise where you personally cannot manage pressure. And again, how do you know if you can manage pressure or not? Well, like I mentioned earlier, you're gonna see signals of not being able to manage pressure. You might notice, and I'd always suggest trying the exercise looking in a mirror to see if you see any of these sort of signs. Either that midline doming or combing, that is that rectus doming, that is the linea alba starting to protrude out, and you're gonna see that if you can't manage pressure. You might also see a little bit of pooching in the low abs. It may be harder to tell during pregnancy, but usually you will feel also a lack of just abdominal control. And that's gonna happen as you progress through pregnancy anyway. But especially with those more strenuous abdominal exercises, like I mentioned, you're gonna just feel that probably pretty soon on in the exercise. And again, if you're seeing rib flaring as you're moving, flexing and flexing your spine, maybe doing some sort of exercise, if you see lots of rib flare, back pain, or if you notice any sort of leaking or symptoms of any sort of other core dysfunction like prolapse, for example, feeling lots of pressure down in that pelvic floor, those would all be signs to just go ahead and stop the exercise. It's not doing any good. In fact, it's probably doing more harm than good. And so these are all exercises that, again, not to be demonized, not to fearmonger. You may need to check with your individual provider, whether that's a pelvic floor PT, a personal trainer, or a medical provider to check what's appropriate for for you. But these are all things that you can be aware of so you know what to look for, and maybe just have your red flags up to know, okay, these might be exercises that could be triggers for diastasis recti during pregnancy. And again, like I said, if you already have diastasis recti, if it is pretty severe and you haven't started that core healing journey, I would not go to these exercises until you've done some more foundational exercises. I'm sure you're wondering, if these are exercises I avoid, well, what exercises should I be doing? And that's exactly where I'm going to take you in our next video. So avoid these exercises. I'm going to share with you in our next video the best exercises you can do to prevent diastasis recti in pregnancy and to heal it postpartum if you already have diastasis recti. So you can both prevent and heal. Now, again, I want to mention a caveat. A lot of diastasis recti is normal, and in almost every individual who goes to full term in pregnancy, you're going to have some abdominal separation. But what we want to do is build that muscle memory throughout pregnancy so that when we begin the healing process, those muscles already know how to work and they come together quicker, and you experience less symptoms and less severe diastasis recti that can linger on and cause lots of pelvic, floor, and core problems down the road. So stay tuned for our next video. Give a like and a thumbs up if this video was helpful, and I'd love it if you'd subscribe already. If you're pregnant and looking for workouts, I'll share my postpartum, or my prenatal rather, playlists with you. I have one for each trimester of pregnancy, and if you're postpartum, I have likewise another postpartum playlist that I will also share if you're looking for exercises to heal your diastasis recti after baby. Thank you guys for being here. I'll see you back here for our next workout together.